turn to your right. There you go. Good. And we're going to go back and rotate a little bit more, turn to your right. Perfect. Good. And exhale, let it all fall. Good. Hey everybody, it's Dr. Warren Kalkstein here at Kalkstein Chiropractic. I'm with a patient of mine named Shelly. Shelly's here to see us for cervical spine discomfort. She's had what's called vertigo, BPV vertigo, benign positional vertigo in the past, as well as some cervicogenic like vertigo as well. So that just means that she's gotten dizzy and it stems from her neck, all right? And so before I start, I just want to say, so grateful to be back and doing videos, and really so grateful for the support and just to be here right now and working with people like Shelly. So it's nice to be back. Again, thank you to the community as well as Shelly. Happy to be here with you. So kind of back up with me, Shelly. You've been coming to see us. You've been a patient of mine in particular for 2+ years. Does that sound right about?
Yeah.
That's off the top of my head.
Yep, about 2 years.
2 years, and just coming back in more recently with the vertigo-like symptoms, right? Tell me a little bit about that presentation and what kind of made you want to come back to see us, and what it's been like for you, just from your end, right?
Yeah. Well, the first time I had vertigo a couple of years ago, and I came, and we really treated that episode. And then I think I came to realize some months later that it was not something that was a one-time event, but likely to reoccur. And so more recently this year, I took advantage of the strength training program, doing the workout on a more regular basis, and that definitely helps to let me manage it, I think, more long-term instead of just responding when I have an episode.
Yeah, so she brings up really two, I think, important topics as it relates to just management of a lot of different problems, reactive care and proactive care, and bridging the gap between the two of them is what she spoke to towards the second round of working not only through the rehab side of things, right, but bringing in a little bit more strength training and trying to change function a little bit alongside of working on the mobility of the tissue and the symptomatic relief that she gets coming into the office as it relates to the dizziness, the neck tension, the neck pain, right? So I hope that kind of fills that gap into what she spoke of, and it's such an important topic because if you could find a team around you, whether it just be a chiropractor or whether it be a chiropractor and a PT, or really, and I speak highly of Shelly as it relates to this, is she's doing her own due diligence and education and working hard towards a good end goal of fixing the problem, right? It's a healthy approach for something. Now you're like, well, everyone should go to the gym and work it out. Well, it's not so simple and straightforward as it relates to that. There's a couple different factors that go into the presentation of those symptoms, and we're making sure that we're getting that to a good point before we bridge that gap. Does that make sense?
Absolutely, because you don't want to injure something else while you're
trying
to fix one problem.
Exactly, and if we just jumped right back in the beginning of that and try to work through it, it would have just created more problem. And then the last thing that I want you to do is to say, pressing, a dumbbell or swinging a kettlebell, actually it makes my symptoms worse. I can't do that, right? And it's not always so clear and dry like that as it relates to healthcare, and a lot of times it's not, right? So, getting the problem, putting the fire out, we'll make it simple, right? And then transitioning over and then challenging it in a really good focused way with great trainers, right, is really important, I think, with a lot of different problems. Shelly did an outstanding job with that, and she's kind of in the transition middle part of that process, and I'm working with her. Schedules sometimes change, right, and we work with that, and so she knows she's got some home things to do, the Epley maneuver being one of those things, as well as making sure that she's mindful of her posture when she sits a lot in front of a computer.
Yeah.
She's in the world of online education. She's amazing at it, which makes her sit even more for it, right? So that's kind of where we're coming from. All right, so I kind of spoke about a couple things that we do. We did a postural program and some exercises and stretches with her. In the beginning, Epley maneuvers are a really powerful thing if you're dealing with vertigo-like symptoms, especially coming from the inner ear. And that's been helpful for her at times. Treating the neck has been the biggest thing for her, though.
Yeah.
Right? And that's really been my job. Okay.
Thank you, Dr. Moore.
You're welcome. Thank you for giving me the opportunity to help you out. I love doing it, and I appreciate you being so grateful for it. So I will say this, I'm going to show you just some of the soft tissue work and some light adjustments that I do with Shelly, and then I appreciate you giving the good feedback that you did. So, Sammy. Shout out to Sammy behind the camera. I'll probably do that for the next like 20 videos, Sammy, just so you know. She's new on the team, and she's here because of someone that she knows pretty well as well, so she was connected to the clinic, and because of that I said, oh, let's see her resume, and it worked out well. In the last couple weeks she's come on board and helped me with some content marketing and doing some of the things that we do here, right? Sharing stories and showing people.
Nice.
So why do we do these videos? Well, if someone's dealing with this problem in my neighborhood and they didn't know that I treated it, it brings them in, that's for sure, part of it. And I think that if I just did it for that reason, I don't know if I would do it as often, to be honest with you, because I think that it's a part of the process. But I also like to educate people, just generally speaking, as it relates to how to receive help and showing good instances of care in terms of chiropractic and physical therapy working well together, and conservative care in general. So there's a lot of different layers of motivation that we do these videos, and I'm grateful to be back and doing them again. Let's do it. All right, you can come on over here, Sammy. I'll show you what I'm doing with the muscles and as it relates to just some of the deeper soft tissue work I'm going through. So as I put my hands on her, I'm palpating, and I'm feeling a little restriction on this right side. Scalene's on the right, just a little bit more hypertonic. And then that's just a static palpation. I'm going to move things. I'm going to see how it's gliding. Everything's moving together. So I'm going to have you bring your head back for me and head down. Good. Head back. Good. Easy. Head down. Good. Turn your head to your right. Good. Come back. Head back. Head down. So a couple different muscles I'm doing. Some of the muscles at the base of the neck. Rotate your head to your right for me again. And the muscles that help erect or keep your head up, right? Head back. Head down. Compression. To the right. Easy. Good. Keep the head down for me and flexion. And now rotate to your right. There you go. Good. A little bit different place that we end up there, right? Head back. Now do me a favor, get lazy. Come on back and settle into it for me. Good. Now head down for me. Good. To the right. Good. She's not good at getting lazy, that's why she left. Head back for me. Head down. Good. Good. Ease into that. Alright, now, so when I come over this side, there's a lot, relatively speaking, I want to find balance between these two shoulders, and I can already tell you I'm going to be working on the scalene, so let's just get right to that, okay? Come stand up for me. Alright, so we're going to be standing here, okay? Table's going to bring you back nice and easy. Would you like me to put it down to get down? You're okay?
Yeah.
Okay. And then you can rest your head. Why do I say that? Sometimes when we've got a little bit of dizziness or vertigo, or if there's anybody that's symptomatic like that, sometimes it's easier to sit and then lay down slowly onto the side instead of going back to the table. Good. So Shelly, I'm going to stretch you out towards me. Good. That's a really nice way to do some long axis traction on that. She felt a little release in the mid-cervical spine, just a little movement. Nice and easy. Okay. So I'm going to rotate her towards the side of the complainant. I'm going to lengthen. I'm going to take my hands and be very broad with this contact. I'm going to compress. I'm going to take traction and lengthen out. Go. Here. You feel it runs almost in a pattern, not just into the side of this neck, but my hands are kind of traveling through that pattern, if you will. Now breathe and let it settle. Good. Good, rotate to the right, keep going, good, to the right, to the right, good, awesome, okay. Good, Chili, turn your head to your right, good, and rest your hand here, hold on to my back, okay, and just nice and gently, you're just going to come here, breathe in, and exhale, let it all fall. Good. Not too easy. Good. Turn your head to your left. And reach across. Hold on to my back. Take a deep breath in. This side is just a little tighter, so you're going to have to almost let it go. Get really lazy. There you go. Good. Nice. Good work.
That was the laziest I've ever been.
Let's go. Always room for change and growth. True. Not giving up today.
Nope.
Nope. Come sit here for me. And then kind of settle in for me a little bit. Good. We're going to rotate left and right. So we've got a really good dynamic team right now. You're going to start to get to know and kind of see some of the other practitioners in the office. And each one has their own special kind of unique gifts and approach to patient care. You'll see that as it goes with medical providers, right? And we're very fortunate to have such a really good dynamic team in relation to that. Good, rotate to your left. Good, and then settle here for me, okay? And then I'll kind of bring you back. And then I'm gonna take you here. So you're already letting go. It'll move a little bit with that compression. Good, head back a little bit more. There you go, rotate to my chest. Good. Good. And then to the right. Head back. Alright, now turn to your left. And to your right. Turn to your left. Keep turning. And come back to your right. Now, turn to your right. There you go. Good. And we're going to go back and rotate a little bit more. Turn to your right. Perfect. Good. And then I want you to turn hard left, hard right. Perfect. Okay. Head back. Let it all settle. Good. Good. Shelly, settle right here for me. Turn your head to your right. Head back. Now kind of fall onto my fingertips. Let your torso almost kind of settle down. Good. Okay. So, a couple different adjustments. The ones you saw me hold and roll her back, those are rib and mid-back adjustments. It clears a lot of the tension between the shoulders and the neck. I did soft tissue work on some of the muscles of the scalenes and the muscles at the base of her neck to really improve range of motion and start to get that to open up for us. And then the last two adjustments were the occipital lift and a rotation adjustment at C2, getting things moving in the upper cervical spine, and really helps with some of these cervical-based headaches and tension and dizziness that she experiences. Now, we're kind of opening up that door again for the rehab and the strength training. How we doing?
Good.
Good? Okay. People have never had that adjustment before. What's that like?
It's a little intimidating
Because
you don't necessarily feel comfortable with having your head kind of yanked
that way.
up.
Yeah.
But at the same time, it definitely creates some space, and like almost immediately relieves tension.
Mm-hmm.
And then for me, over time, like I can tell that when the space is getting compressed or going away is definitely when there's more opportunity for the tension
Mm-hmm.
to come back. So
Yeah.
it's a little uncomfortable, but if you flow with it, it can have some great results.
I appreciate you flowing with it, and then reinforcing, coming back to like what keeps that space open, right? It's movement, it's stretching, it's like being active and mindful. And Shelly's not the case that I can attest to because she's perfect, but some of us, right? Some of us fall out of that routine, right? Right? No, all of us do. So being mindful and just getting into a structured routine is so helpful when it comes to your body's health, and you don't know it, but goodness kind of sneaks up on you, right? Health really is like a longevity type thing in a way, and so it's not that instant gratification that we're used to, which the adjustment is kind of like that, but it's over time, right? And that's what I keep trying to speak to with these videos, and I hope you understand that watching, that it's just it's a journey.
It's a journey.
It is. All right. Thanks for watching, everybody. It's good to see everybody. Shelly, as always, it's a pleasure getting to work with you. Sammy, welcome to the team.